CA Productions invites you to join us for Coastal Connections with Courtney. This new and exciting television program is designed to showcase wonderful things taking place in South Mississippi. Join Courtney Anderson as she personally takes you on a journey all along the Mississippi Gulf Coast. You'll meet many local leaders, business owners, and interesting people who make a positive difference in these communities. Coastal Connections with Courtney will also showcase a wide variety of great places to eat, shop, and explore. There's so much to see in South Mississippi, so come along for the ride and enjoy Coastal Connections with Courtney.
Hi everyone, and welcome to Coastal Connections with Courtney this Sunday. Here we are in Gulfport, Mississippi at the Gulfport Surgery Clinic. We all get the honor to be educated and get to know Dr. Paul Mace. Hi everyone, and welcome to Coastal Connections with Courtney this Sunday. Here we are in Gulfport, Mississippi at the Surgery Center. We have the honor to meet with the one and only Dr. Paul Mace. And Dr. Mace, thank you for taking time to meet with me in October. I wore my pink. It's October Awareness Month. Very dear to a lot of people's hearts, and you've made such a difference and influenced so many lives.
Thank you. No, I'm very glad to have you here today.
Well, I'm very grateful that you have the time to meet with me and kind of educate the Gulf Coast. We all know what breast cancer is, but do we really know it, what the disease is, how we can prevent it, and what exactly you do on a daily basis?
So breast cancer is one of the most common cancers that affect women. It's something that I've spent a lot of time in my practice. It's about 50% of my practice treating. It's something I've had a big interest in ever since I came to Gulfport. Trying to make sure we had the latest and greatest here at home for our folks here at home. Breast cancer is basically a change in the breast cells that causes them to continue to grow in an uncontrolled manner and start to invade the cells next to them. Once that happens, the breast cancer can start to spread to other areas of the body, which is why it's very important to try to detect it as early as possible, and that's one of the big things that we focus on, especially Breast Cancer Awareness Month this month.
Absolutely. And when you say, let's try to detect it early, when you say that as viewers are watching, is there a certain age, and what are we detecting and looking for? How can we do that?
So traditionally we've encouraged women to get breast screens at age 40 and older,
Okay.
But about 30% of my breast cancer practice are women less than 40. So, I think probably starting at age 30, it's a good idea for women just to start to check themselves every month and get an idea about what their breasts normally feel like.
Right.
Younger women are going to have more dense, firmer breast tissue, so it's going to feel a little firmer, harder, and then as they get older, it'll get a little softer. Every woman is going to feel some little irregularities, lumps and bumps and things that are normal for her, and that's really why we want women to check every month so they get used to their normal lumps and bumps. That way, if anything were to change, they'll be a lot quicker to pick up on it. With the monthly self-exams, and again, in women that are 40 and over, we recommend that they get a mammogram every year. We also recommend that they follow up with their physician, whether it be their primary care doctor, their OB/GYN, breast surgeon, just to get checked as well to make sure that there's nothing there. And then for women less than 40, again, if you're checking yourself every month, you come across something that hadn't been there, you're concerned about, get in with a physician and let them check it out.
Right. So you are the breast surgeon. I know you have been practicing surgery. Everyone knows Dr. Paul Mace and your family, but you've been doing this over, is it 23 years?
25 years.
25 years.
So breast surgery is about 25% of my practice, 50% of my practice.
Okay, 50%.
And again, typically patients will be sent to me that either have a lump or abnormality they've found and it needs further workup, or someone that has already had a diagnosis of breast cancer. In the old days, most of the lumps and bumps would get a surgical biopsy. The majority of the biopsies we do now are image guided. So if there's an abnormality on the mammogram, that patient will get a needle biopsy that's directed by a mammogram, so we can get a small sample of that tissue to see if it's cancerous or not. If there's a lump that we can see or a lump that's visible by mammogram or ultrasound, then they may get a little ultrasound guided needle biopsy. So most of the patients I see will already have a diagnosis of breast cancer when they come in.
Right.
So part of my job is to try to help educate the women that come in about their breast cancer and trying to figure out which of the treatment options we have is going to be best for them. There are a lot of variations of breast cancer. There are different types of breast cancers. We also have a lot of variations in things we call hormone receptors within the breast cancer that can incorporate things like estrogen receptors, progesterone receptors, HER2 receptors. The combination of those different receptors in conjunction with the size of the tumor can also help dictate whether we would do chemotherapy first and then surgery, or surgery first and possibly not have to do chemotherapy, just treat with a hormone blocking pill.
Does that happen often? That's a really good case, right? I mean, that's something you are hopeful for.
Well, what we're seeing now, thank goodness, with the improvement of all our technology. You know, back in the day, mammograms were film and then analog and then digital, and now we have 3D mammograms. So we're really finding so many of these cancers so much earlier and at such a smaller stage, so that the majority of my patients now are stage 1 or stage 2. They're not stage 3 or stage 4. Staging basically involves the size of the tumor when it's diagnosed, whether or not there are any lymph nodes near the tumor involved, whether there's any spread from the lymph nodes to other areas. You also have something called stage 0, which is a type of cancer, DCIS, ductal carcinoma in situ, which is pre-cancerous, pre-invasive. So under the microscope, it looks like a breast cancer, but it hadn't quite gotten there yet. So we're also picking up a lot of these at stage 0 in the pre-invasive stage, and that's much easier to treat and cure. So that's why our cure rates are so much higher. That's why our success rates and remission rates are so much higher. And then the technology of what we have to offer with reconstruction has also gotten so much better. In the old days, our reconstructive options were not that great. You know, now we have the ability to do a nipple sparing mastectomy in certain patients, to where we can preserve the entire skin envelope of the breast, the nipple, and the areola, and then take out all the breast tissue underneath and do a reconstruction with either implants, or the latest thing is we can take tissue from the abdominal area. It's the same thing if a woman was going to get a tummy tuck. But instead of taking that tissue out and throwing it away, we can transfer it up to the chest wall, use her own natural body fat to recreate the breast tissue.
Well, you know, you say the latest technologies. One of the things, I've had so many requests and so many people tell me stories when the scary word breast cancer comes up. But you have performed the first, you know, procedures and techniques ever on the Mississippi Gulf Coast. And, you know, as I'm reading about them, I don't think a lot of people know we offer that on the Gulf Coast. That somebody that has been practicing over 25 years, the top-notch school and education, is providing what people are Googling and looking for out of state.
Well, and it's funny you mentioned Google. We've been doing the tummy tuck reconstruction. We've been doing that here since 2015.
Okay.
And at the time we started, we were the only reconstructive team in the state. Dr. Michael Diaz, who you interviewed a few weeks ago, and then Dr. Hugo St. Hilaire, who's the head of plastic surgery at LSU. We have a 3-man team that works on these surgeries together. And we started in 2015. We do about 100 flaps per year. And during that time, our results have been so good, we now have women coming from as far as Columbus, Mississippi, Greenville, Laurel, Hattiesburg, Mobile. You know, the word is getting out, and a lot of women are finding us on the internet now. You know, word of mouth and Googling, and it's nice to be able to offer something so that they don't have to go to Houston, they don't have to go to New York, they don't have to go to Jacksonville. You know, we've got everything right here.
Top notch, and you're loyal. You know, your expertise is so high up there, and the testimonials, all, you know, as I was reading about your testimonials, that says enough for the person, you know, having a life-threatening scare, trying to find who they can trust and, you know, move forward with in such a scary experience.
Well, we're very passionate about what we do, and we're very passionate about being here on the Gulf Coast and one of the best for our friends and neighbors. You know, I have been very fortunate to be able to get up with Dr. Diaz and Dr. St. Hilaire. You know, they are outstanding reconstructive surgeons, and I couldn't ask for a better reconstructive team, and, you know, the results have borne that out.
When you say a team, will y'all go, he'll do his procedure and you want to make it a time-efficient thing for the patient more comfortable? And what does that mean?
Well, so basically, we're doing this all in a single step. We're doing the breast cancer removal and the reconstruction all in one operation.
So in one day, you can get all of that taken care of,
Yes.
and then rest and heal.
And then based on what we find out on the final pathology report regarding the final staging, you know, then we'll figure out if the patient needs additional treatment. Will they need a hormone blocking pill? Will they need chemotherapy? You know, in rare cases, they may need radiation. So it just all depends, but we're able to achieve a much better cosmetic result for the patient. It's obviously our first priority, and the most gratifying thing is to cure the cancer.
Sure.
But once we're beyond that, you know, we want our patients to be able to look in the mirror and be happy with themselves and happy with how they look and feel good about themselves.
So cosmetically, you don't have to look like you've been gone through all of this. You can look like you just went and maybe got breast augmentation?
Yes, yes. I mean, and that's, you know, we literally have patients who look better after their cancer treatment than they did before.
Oh.
Now, you know, unfortunately, that's not every single patient.
Sure.
And it varies by individual, but, you know, we're getting outstanding cosmetic results in the majority of our patients, and that's gratifying to us in addition to knowing that we're curing the cancer.
Well, we're blessed on the Mississippi Gulf Coast to have you in this latest technology, because you provide so much here for us, and you're a wonderful doctor, and want to hear more about you after the break. And thank you so much for educating myself and the Mississippi Gulf Coast. We will be right back.
Visit the Gulf Coast's newest casino.
Come in today and experience the beautiful smoke-free Beachview Casino.
Pick your game. We have your favorite slots and table games and a sports book.
Enjoy incredible views while you dine at one of our many restaurants.
And grab a drink while you enjoy live entertainment every weekend in the heart of the action.
The Gulf Coast's newest, the smoke-free Beachview Casino Resort, Gulfport.
Thank you for calling J. Allen Toyota Service.
This is what happens when you set an appointment at J. Allen Toyota Service. We will order the part right then, so it'll be here when your appointment comes. Our greeter staff will greet you quickly and friendly and top off your fluids before your car even leaves the drive. Then your car will go to one of our 6 two-man express teams or one of our 10 certified technicians so they can get you back on the road safely and quickly. This is service the way it should be at J. Allen Toyota Service.
I Experience Mazda now at Bujaj Select Mazda in Gulfport. We have select new Mazda inventory on the lot now. Mazda CX-9, CX-5, CX-30, and Miata. Visit us today on Airport Road in Gulfport.
Are a beacon of healing, resolute and consistent, determined. We are problem solvers, driven to overcoming obstacles, unshakable. We are prepared, capable, experienced, unbeatable. We are a network of people providing care throughout your lifetime. We are believers in the healing power of compassion. We are Memorial.
Dr. Mace, I feel like I've learned so much, and you've informed to me more about the disease of breast cancer. You know, you do all the latest procedures right here at the surgery center. You work alongside with other people like Dr. Diaz. But tell me a little bit about the prevention, the people that are watching, the people that have people in their lives that have dealt with this. How can we prevent this so that we don't have to go through this?
So the most important thing women can do proactively to try to prevent breast cancer is just to try to lead a generally healthy lifestyle. If you're smoking, you got to quit. Cigarette smoke and the carcinogens, the cancer-causing agents in that, are not responsible for breast cancers, colon cancers, lung cancers, heart disease, you know, just a whole plethora of bad things. So, and that's one of the biggest things I talk to my patients about when they come in if they're smoking. You know, we can't even perform a lot of these surgeries if they're actively smoking because the effects of the nicotine are so bad on blood flow to the areas they're trying to heal up. It causes wound infections and other problems. But just smoking is, you know, stopping smoking is a given. You know, that's the best thing you can do. And the other thing is just trying to lead a generally healthy lifestyle. You know, if you're overweight, you know, try to diet, try to exercise, try to get down to a healthier weight. It will not only help reduce your risk of breast cancer and other cancers, but heart disease, diabetes, high blood pressure, you know, a lot of different medical problems can be benefited by losing weight, exercising, you know, living a healthier lifestyle. Alcohol in excess has been linked to breast cancer in women. You know, you can certainly have a glass of wine here and there, but, you know, 3 or 4 glasses of wine every single night are certainly not healthy and, you know, are going to increase your risk. Trying to, you know, eat healthier, you know, get more lean protein, less fat, less carbohydrate in the diet, things like that. Not that there's a direct cause between that and breast cancer, but just, again, getting in,
like
eating healthier, losing weight,
proactive?
and trying to do as much as you can that way. And then again, I can't stress enough just making sure you're checking yourself every month and keeping an eye on things. 90% of the breast cancers we treat are caused by a spontaneous mutation of the breast tissue. About 10% of those are because of hereditary factors.
I was going to ask that because you could be perfectly healthy and fit, and then be like, you know, the demonstration of somebody that you would never think would get cancer.
So, you know, even if you don't have a family history, and if you're doing all the right things, you can still potentially get a breast cancer. Your odds are about 10 or 11%, you know, lifetime risk. So it's not a huge risk, but again, just being proactive, you know, checking yourself every month, getting your mammograms on time, you know, staying up to date with your physician visits can go a long way. We, you know, and that's why this month, you know, we really try to highlight this as much as we can, getting the word out to people and to women. Hey, you know, check yourself, get your mammogram, see your doctor, lead a healthy lifestyle, and you know, hopefully we won't have to deal with this.
Absolutely. And breast cancer awareness this month, October, I know it means a lot to you and your family, and you know, you're just such a prominent doctor and you know so much. I think it's really neat how you sit down with them. So you said, my job is to educate. I mean, you are educating and knowing what's going on with your body. It helps with the fear. It helps with the emotional aspect of it. And I would like to know, I know you don't like to talk about it, but when we went back there, you have every award, all these books. I said, Dr. Mace, have you read these? And you said, every one of them. And you're a hard worker, you're disciplined. Have you always wanted to be a doctor?
I really did, ever since I grew up. I grew up in Montgomery, Alabama, and went to the University of Alabama, went to medical school in Alabama. I met my wife, Jennifer. She was in nursing school and I was in medical school. And so we both wound up in New Orleans working. I was trained at Tulane. And in between the training during weekends we would have off, we would come over to Gulfport, and it was close and easy, and just absolutely fell in love with the area. And so when I finished training at Tulane in 1997, you know, I wanted to come over here and start.
You just loved it? You just were like, this is the place?
Yeah.
Awesome.
So,
and so you meet your wife, and how long have y'all been married?
29 years. Got 30 years coming up in April.
Oh, I love everybody knows Jennifer. And where are you born and raised if you moved here to the coast?
Right, so Montgomery, Alabama is where I was born and raised.
Montgomery, Alabama.
Yeah.
And you've always had an itch for the medical field and you discipline.
Yeah, and that rubbed off on the kids a little bit. My oldest, Emily, went to Ole Miss and went to nursing school, and she's working in Baton Rouge now. My son Hunter's in his second year of medical school at UMMC in Jackson. My daughter Caroline decided that medicine wasn't her gig. She's a junior at Alabama and she wants to go to law school. So.
Oh, wow. But all sharp as whistles. Yeah. So do you see a lot of people daily, like, I mean, do you feel like the rates in breast cancer are rising here on the Mississippi Gulf Coast?
We're seeing more of it, but it's not necessarily the rates are rising. We're picking it up a lot earlier. So we're catching
because
it.
of the technology and the service
Exactly.
that and you're one of the first people. Tell me about that. Like, it said at least 7 things. He is the first one that performed this. What exactly is that? So you're like the latest technology when it says MD Anderson or the surgeon in Dallas. How would I know it's offered right here?
So the DIEP flap reconstruction,
Yes.
and again, that's the nickname for it's the tummy tuck flap. So,
Okay.
and it's what we talked about before, taking the tummy tissue and transplanting that up to reconstruct and use that to reconstruct the breast tissue. That is sort of the pinnacle of what's available for reconstruction. In the old days, we just had initially tissue expanders and implants. We didn't have nipple-sparing mastectomies. I started doing the nipple-sparing mastectomies around 2007. And at that time, we were just doing that with an implant-based reconstruction because we didn't have, you know, the flap techniques like we have now. But then being able to incorporate that in about 7 years ago, and that has really made a difference for our patients here on the coast. And so now they don't have to travel hours and hours away. We've got the latest and greatest, and we're also blessed to have exceptional oncologists here on the coast. So when we're finished with the surgery, we've got some of the best and brightest that do the rest of the cancer treatment right here. So you don't have to go to MD Anderson.
So comforting, yeah.
You don't have to go, you know, anywhere else. You can really get everything you need right here.
Absolutely. And Dr. Mace, on top of all this, I bet I can tell you love your patients. The way you talk, how your patients, you stay in touch with them. How do you cut it off at night after doing surgery and seeing these cases? And I know that's an emotional attachment. And then going home, you have such a beautiful, solid, disciplined, healthy family. Right. But you also have a good time. You're involved in so many community activities.
Well, it's not necessarily cutting it off. It's just, you know, I mean, exercise is a big thing to me. I love to exercise.
I know.
It's kind of my stress relief and how I, you know, kind of deal with things. I could not do any of this without Jennifer. Without
Oh, I knew it was coming. Yes.
So that's a big part of it. And when you enjoy what you do, and you know.
Well, I'll tell you what, we're so lucky, and as the Gulf Coast grows and people like you, not just anybody can be a doctor. No. I think it's a God-given gift, and not only are you brilliant, you also have that empathetic heart, big heart, and you live it. And, nobody wants to hear the word cancer, but if you do, they can come to somebody like Dr. Paul Mace and trust that you have the latest things. We don't have to travel. We can stay right here on the coast.
Yeah.
And you love the coast.
I do.
And you love your job. And I know we're going to be seeing a lot of you on the news. I was grateful because I'm able to educate myself and a lot of other people, because you can read about it, but it's a different experience when you sit on one-on-one with the surgeon, with your experience. So if you have anything to tell the coast, what would you tell the Mississippi Gulf Coast? Just anything. We're kind of like a family around here, and cancer is scary.
Well, just again, I can't say it enough times, early detection is the most important thing. So ladies, check yourself every month. There's no right way or wrong way to do it. Just check however you can. Get to know your breast tissue, get to know your little lumps and bumps and what's normal for you. If you come across something that you're not sure about or you're concerned about, please come get it checked out. Go see your family doctor, go see your OBGYN, come see me, we're here. Make sure you're getting your mammograms on time. Make sure that you're getting your normal yearly checkups on time. Early detection is the key.
Well, I appreciate that. And one thing about you, you're just such a good person. I said, what is the main thing of course it's October for breast cancer, but you said, I just want to educate. I just want people to understand what's going on, and and that's just pretty cool. You didn't even want to talk about you or anything else, but I wouldn't leave it out. You have the biggest heart, and I have about 10 people on my heart that have dealt with this that just rave about you, and you're still in their lives today.
Well, thank you.
So thank you, and thank you for this opportunity.
Thank you.
And I want to thank everyone for tuning in to Coastal Connections with Courtney on another Sunday. We will see you next week.
Experience Mazda now at Butch Select Mazda in Gulfport. We have select new Mazda inventory on the lot now. Mazda CX-9, CX-5, CX-30, and Miata. Visit us today on Airport Road in Gulfport.
Visit the Gulf Coast's newest casino.
Come in today and experience the beautiful smoke-free Beachview Casino.
Pick your game. We have your favorite slots and table games and a sports book.
Enjoy incredible views while you dine at one of our many restaurants.
And grab a drink while you enjoy live entertainment every weekend in the heart of the action.
The Gulf Coast's newest, the smoke-free Beachview Casino Resort, Gulfport.